Thank you very much, and good morning, everyone, and happy Human Rights Day. I'm sorry I couldn't be there in person. I would just say a few words of background just to situate our current work. Since 2009, the issue of maternal mortality and morbidity has been on the agenda of the Human Rights Council, and the discussions at the Council were influenced by wider international recognition of the fact that maternal mortality and morbidity is not just a sad fact of life, but rather can often be traced to denials of women's human rights and persistent inequalities. At the Council's request, OHCHR developed a body of work explaining the human rights dimensions of maternal mortality and morbidity and highlighting promising practices to address these issues through a human rights-based approach. And in 2012, a critical step was taken with the development of a technical guidance on the application of a rights-based approach to maternal mortality and morbidity. The technical guidance is important because it provides focused and practical guidance on how states and other stakeholders can take action to address maternal mortality and morbidity while upholding their human rights obligations. I understand there are copies of the technical guidance in the room. So if you look at it, you will see that it begins with some crucial principles that are the basis for a human rights-based approach. And these include recognizing that maternal health cannot be separated from wider recognition of sexual and reproductive health and rights, that priority action is required to marginalized and disadvantaged groups, that rights holders are active agents with entitlements, as the first speaker said, and they must participate in decisions affecting them, that duty bearers have obligations to ensure the right to health as well as other human rights as provided for under international human rights law. In other words, this means that these are binding obligations and not matters of charity or goodwill. And finally, that accountability for the realization of rights is relevant at all times. Following these principles, then the technical guidance uses the policy cycle of planning, budgeting, implementation, monitoring, review, and remedies to provide concrete directives on what is required by a rights-based approch. Now, since the guidance was welcomed by the Human Rights Council in 2012, the Office of the High Commissioner for Human Rights, OHCHR, has been pushing for its implementation in collaboration with numerous partners, including several panelists and institutions that are in the room today. The work has been taking place in several countries, but I will just briefly speak about our work in Uganda and Malawi. In these two countries, we support the undertaking of human rights assessments of sexual, reproductive, maternal, and child health. And the assessments, which are mostly desk reviews, provide an overview of human rights challenges faced in the countries related to these issues. So these assessments were used as the basis to start or deepen dialogues in the form of multi-stakeholders dialogue to identify challenges and agree on action points. Now, in the case of Uganda, the multi-stakeholder dialogue took place last year in November 2014, and it identified the need to enhance capacity of relevant stakeholders to work on human rights related to sexual and reproductive health and rights. And accordingly, in 2015, OHCHR has focused on training civil society organizations on methodologies to monitor and document violations of sexual and reproductive health and rights. And in 2016, the intention of the office is to build capacity of health workers to apply rights-based approaches. UNFPA has also been working with the Ugandan Human Rights Commission to build capacity on monitoring sexual and reproductive health and rights. Another key area of action that was identified in Uganda was the need to engage with the judiciary to enhance understanding of the justiciability of economic, social, and cultural rights, and in particular the right to health. And this is an area in which OHCHR as well as civil society organizations have been active for a few years. And as a result of a strategic litigation effort by a leading civil society organization, the Supreme Court of Uganda recently ordered the Constitutional Court to hear a claim pertaining to Uganda's failure to provide maternal health services. And this is potentially a very positive development for effective accountability for preventable maternal deaths. Now, in Malawi, the preparation of the assessment was conducted in parallel to a national inquiry on sexual and reproductive health and rights, which was initiated by the National Human Rights Institution. The two reports were considered together at a multi-stakeholder dialogue which took place in October 2015, so very recently, and there was a very high degree of convergence in the recommendations of the two exercises. Importantly, the Malawi Human Rights Commission is intending now to bring the discussion to the district level, which is where many barriers to effective enjoyment of rights were identified. Also, action on sexual and reproductive health and rights at the district level now features very prominently in the Human Rights Action Plan of Malawi, which was validated last week on the 4th of December and is due for adoption very soon, as well as a draft joint work plan between the United Nations and the Malawi Human Rights Commission. Another key area for action in Malawi concerns law reform, and several stakeholders are supporting ongoing efforts to reform the abortion law, as well as to advocate for a comprehensive law on sexual and reproductive health and rights. Now, in both these contexts, the engagement of a variety of partners, including government, civil society, and the UN, has been critical because it has allowed us to capitalize on the strategic advantage of differently situated allies. Now, lastly, I just wanted to mention that recognizing that everyone has a role to play in applying a rights-based approach to sexual, reproductive, maternal, and child health, OHCHR, together with UNFPA, WHO, PMNCH, and Harvard, has developed reflection guides directed at particular groups to articulate more in detail the type of issues which they should be considering in their work to see if they are really applying a human rights-based approach. 2 reflection guides have been released for health policy makers and national human rights institutions, and 2 more are in the making and hopefully will be released in the first quarter of 2016, addressed to health workers and members of the judiciary. Thank you very much.
Thank you, Veronica.